ankylosing spondylitis. Define symptoms, causes. Definition. Ankylosing spondylitis is a type of arthritis that causes inflammation in the joints and ligaments of the spine. It may also affect peripheral joints like the knees, ankles, and hips. Normally, the joints and ligaments in the spine help us move and bend. Symptoms. In the early stages, ankylosing spondylitis is likely to cause stiffness and pain in your lower back in the early morning that lasts at least 30 minutes and then eases through the day or with activity, pain that wakes you in the night, pain in one or both buttocks and sometimes the backs of the thighs. The condition can sometimes be mistaken for common backache. Common backache often comes in short and painful spells. But the pain from ankylosing spondylitis is likely to be long-lasting. You may also have neck, shoulder, hip, or thigh pain, which is worse when you've not been active for a time. For example, if you sit for long periods working at a desk. Some people have pain, stiffness and swelling in their knees or ankles. The pain and stiffness can vary over time. If most of the spine is affected, it can cause difficulty with activities that involve bending, twisting, or turning. Other possible symptoms include soreness at the heel or in the arch of your foot, pain and swelling in a finger or toe, tenderness at the base of your pelvis, which can make sitting on a hard chair uncomfortable, chest tightness around the chest that comes on gradually. This can make it difficult to take deep breaths. Your ribs may feel very tender, and you may find that you're short of breath after even gentle activity. Coughing or sneezing may cause discomfort or pain. Inflammation of the bowel. People with ankylosing spondylitis can develop bowel problems known as inflammatory bowel disease, IBD, or colitis. It's a good idea to see your doctor if you have diarrhea for more than 2 weeks or have bloody or slimy poos. Fatigue, which is severe tiredness that doesn't improve with sleep or rest. This can be caused by the condition itself, as well as this is when people have a lack of red blood cells, which carry oxygen around the body. Depression and anxiety, inflammation of the eye, called either uveitis or iritis. The first signs are usually a painful and sometimes red eye. It may become uncomfortable to look at bright lights. Causes. About 95% of people who have AS have a variation of the human leukocyte antigen B gene, HLA-B. This changed, or mutated, gene produces a protein called HLA-B27 that increases disease risk. However, most people with a mutated HLA-B gene don't get AS. In fact, 80% of children who inherit the mutated gene from a parent with AS don't develop the disease. More than 60 genes have been linked to the condition. Having one of these conditions may also increase your risk. 1. Crohn's disease. 2. Ulcerative colitis. 3. Psoriasis.